Hello everyone, welcome again to my channel. Let's discuss physiology. Today we are going to discuss a very important topic or a very important question frequently asked in the context of glucocorticoids is anti-inflammatory and anti-allergic effects of glucocorticoids. So here the glucocorticoids, or simply GCD, the short form, the glucocorticoids inhibit the inflammatory response to any tissue injury, and also they inhibit the manifestation of allergic diseases which are due to the release of the histamine from the muscles and the basophils. Almost everyone know that the histamine is a major inflammatory marker, and the histamine is very much allergic to the skin, and it has pruritic in action on the skin and vasodilator. So these glucocorticoids, both of these effects, that means the inhibition of the inflammatory response and inhibition of the histamine secretion, both these effects require increased level of the glucocorticoids in the circulation and cannot be produced by the administering glucocorticoids without producing other manifestation of the glucocorticoids excess. That means to inhibit those manifestations of the histamine and the inflammatory responses, we need some amount of the glucocorticoids which are clearly much more in amount, which is not in that circulation. So what are these disadvantages of this large systemic dose of the glucocorticoids? So whenever we give these large doses of the glucocorticoids to inhibit the actions of the allergy or allergens, they inhibit the ACTH secretion to the point where severe adrenal insufficiency can be a dangerous problem, and when the treatment is stopped. So what are the local administration of the glucocorticoids in high doses occurs? So however, local administration of the glucocorticoids, for example by injection into an inflamed joint or near an irritated nerve, this produces a increased local steroid concentration, often without enough systemic absorption to cause serious side effects. Example, in tennis elbow or in trigger finger, we give local steroid injection, and this local steroid injection has no systemic side effects. Remember, they only increase, or the injection of this glucocorticoid simply increase the local steroid concentration, and they have no systemic side effects. So role of the glucocorticoids in the bacterial infection. Actions of the glucocorticoids in patients with bacterial infections are dramatic, but as well as they are dangerous. Example, if in case of the pneumococcus infection or pneumococcal pneumonia or active tuberculosis, we give the glucocorticoids, then the febrile reactions, the toxicity and the lung symptoms disappear. But unless the antibiotics are given at the same time, the bacterial spread occurs throughout the body, because the glucocorticoids are very much immunosuppressant. So they remove all the symptoms of the bacterial infections all over the body or in the local responses, but as well as they inhibit the systemic immune response against the bacterial infection, the bacterial spread occurs throughout the body, and maybe there is a chance of septicemia. So what are the disadvantages of the glucocorticoid therapy? It is important to remember the symptoms are warning signs of a disease, and when the disease is present, and it clearly shows that something is wrong in our body. But when the symptoms are masked by the treatment of the glucocorticoids, there may be serious and even fatal delays in the diagnosis and institution of the treatment with the proper antimicrobials. So now let's discuss how this inhibition of the immune response occurring by the treatment of the glucocorticoids. So at first, let's start about the effect of the glucocorticoids on the blood cells and the lymphatic organs. So there are a few important points here. Glucocorticoids inhibit the number of the circulating eosinophils by increasing their sequestrations in the spleen and lungs. Number one. Number 2, glucocorticoids also decrease the number of the basophils and increase the number of the neutrophils, platelets and the RBCs. Glucocorticoids decrease the lymphocyte count and also decrease the size of the lymphoid organs or lymph nodes and thymus by inhibiting the lymphocytic mitotic activity. Next point, glucocorticoid also decrease the cytokines by inhibiting the nuclear factor kappa beta on the nucleus, and by which the decreased secretion of the interleukin 2, which is an important cytokine, and therefore it leads to decreased proliferation of the lymphocytes and they undergo the apoptosis. So in nutshell, if we see the effects of the glucocorticoids on the blood cell and the lymphatic organs, it's clearly visible that the number of the platelets are increased, number of the RBCs are increased, number of the neutrophils are increased, but the number of the eosinophils, basophils and the lymphocytes are decreased, and also there is decreased lymphoid organ size and activity. So we discussed the action of the glucocorticoids on the nuclear factor kappa beta on the anti-inflammatory and anti-allergic effects. Next, an additional action by which it combats the local inflammation is by inhibition of the phospholipase A2, or simply PL-A2. It decreases the release of the arachidonic acids from the tissue phospholipids, which decrease the leukotriene formation, and also it inhibits the prostaglandins, prostacyclins and thromboxane production by this arachidonic acid pathway. So you can easily see by decreasing the effects of the prostaglandins and decreasing synthesis of the prostaglandins, the glucocorticoids also exert the anti-inflammatory and the anti-allergic response. Some other effects of the glucocorticoids on this context are, if we give the larger dose of the glucocorticoids, they also inhibit the growth, they inhibit the growth hormone production. Simply, this is how they inhibit the growth of different tissues and the body structure. They also stimulate the enzyme named PNMT. The full form is phenyl ethanol amine N-methyl transferase. This enzyme is very much responsible for the conversion of the non-epinephrine to the epinephrine at the level of the adrenal medulla. The larger dose of the glucocorticoids also responsible for the decreased thyroid stimulating hormone production or the secretion from the anterior pituitary. And during the fetal life, the glucocorticoids also increase or stimulate the maturation of the surfactants in the lungs. So in nutshell, in this context, we can easily see how the glucocorticoids acts, and they exert the effect of the anti-inflammation and the anti-allergenic response all over the body. But the main disadvantage in nutshell is that even they remove all the symptoms or the febrile reactions or the any type of disease symptoms due to bacterial infection or bacterial spread, they cannot inhibit the spread of the bacterial infection throughout the body. And if we don't use a proper antimicrobial side by side with the treatment of the glucocorticoid therapy, then there is a chance to production of the bacterial septicemia throughout the body, and maybe it is fatal. So please remember, the glucocorticoids treatment over this context is advantageous, also disadvantageous side by side. Thank you all. Please like, share and subscribe my channel, and please ask for me if there is any question, and please request if you want to see much more videos on any other topic on the physiology.